When observing yourself, ask yourself, what structure or structures are involved? And that requires knowledge of anatomy. And if you're not sure, go and look it up. And then ask the question, is this observation of likely clinical significance? And if you don't know, ask somebody who might know. Take a photograph. Send it to an expert. When we see obvious muscle asymmetry, we have to ask the question, is the larger side hypertrophied or the smaller side atrophied? When observing muscle atrophy, we have to ask the question, is this a pattern of muscle atrophy that is likely to reflect disuse, or is it more likely, by its distribution, to be neurogenic muscle atrophy? The pictures on the left depict a horse 9 days and 6 weeks, respectively, after a collision with a solid object during a thunderstorm. Here we have evidence of neurogenic muscle atrophy, with atrophy of the deltoideus and infraspinatus muscles. Neurogenic muscle atrophy can occur with remarkable rapidity. At the initial examination, 9 days after the collision, the horse exhibited a grade 1 out of 4 shoulder instability and a grade 4 out of 8 right forelimb lameness. At the re-examination 6 weeks later, the shoulder instability, had resolved. Lameness had improved, but still persisted at grade 3 out of 8. And this is the reason why. The horse had a displaced fracture of the first rib. And now we have to consider neuroanatomy. The infraspinatus muscle is innervated by the suprascapular nerve derived from the 6th, 7th, and 8th cervical nerve roots. Deltoideus is innervated by the axillary nerve derived from the 7th and 8th cervical nerve roots and the 1st thoracic nerve roots. We can see in the diagram on the right how these nerve roots contribute to the brachial plexus, from which the axillary and suprascapular nerves branch off from, and how integrally involved the brachial plexus is with the first rib, particularly close to the site of the fracture. In this horse, we can see that there is profound neurogenic atrophy of the left triceps, biceps brachii, and pectoral muscles. The horse also had unilateral sweating. This was associated with nerve root injury of the 7th and 8th cervical nerves. In this horse, and the picture on the left, we can see that the point of the left shoulder is prominent. In the picture on the right, we can appreciate that there is mild atrophy of the left triceps, supraspinatus, and infraspinatus muscles. Careful palpation revealed that there was firm swelling of biceps brachii. This was associated with left forelimb lameness, and radiological evaluation revealed that there was extensive dystrophic mineralization within the tendon of origin of biceps brachii, with secondary modeling changes of the humeral tubercles. Note also the smoothly marginated new bone on the cranial aspect of the greater tubercle of the scapula. This horse has sustained a kick injury on the medial aspect of the antebrachium. With any such injury, we must always be aware of the possibility of a fracture of the radius.